Fever is just an increase in temperature. So your temperature can go up or down, but fever is the increase above a certain temperature. For neonates that are less than 2 months, we consider a fever 100.4, and in children greater than 2 months, it's 101.1. Fever not necessarily is bad. So what happens is that your temperature goes up. If your temperature rises very quickly, you can have febrile seizures. And so that's where it gets a little bit scary for people. But a fever is your body's way of saying, hey, I'm fighting something off. I want to, build up that immune system, that kind of thing. So it's not all that they're all bad, and it's not all that they're going to cause seizures and things like that if they go really high. It's about how fast they go up. Fevers can be infectious. You can also have fevers secondary to certain kinds of cancers and things like that. Autoimmune diseases can cause fevers as well. So if you have fevers for greater than 2 weeks that are kind of nightly, that kind of thing, you definitely want to see a physician about that. So when you're measuring a child's fever at home, you typically want to do an armpit measurement. You can also do tympanic, which is in the ear, but the ears are a little bit more accurate once they get a little bit older. If you're measuring a temperature in a child that's less than 1 and it is showing a fever, then you want to confirm that with a rectal temperature. So you can treat fevers under 6 months with Tylenol. Once you are over 6 months, you can use ibuprofen as well. A child under 2 months should definitely see a physician if they have a fever. So ibuprofen, you want to wait until 6 months, and that's because the blood vessels in the brain are a little bit more friable, and so if a child were to roll off of something and tear one of those vessels, we want it to be able to clot up. And then also the liver isn't as developed until 6 months, and so can't handle that ibuprofen as well as, say, a 6-month-old or longer. If your physician says it's okay to give ibuprofen, which we do sometimes under 6 months, then it's fine. You definitely want to avoid aspirin in the setting of fever, as it can cause what's called Reye syndrome. Typically, to make a child feel better when they have a fever, because you do not feel well when you have a fever, is they can treat the fevers with ibuprofen or Tylenol. Again, if they're over 6 months, that ibuprofen is suggested. You can rotate those every 3 hours so that you're giving Tylenol, and then 3 hours later you're giving ibuprofen, and then 3 hours later you're giving Tylenol. That allows you to give something, the Tylenol every 6 hours and the ibuprofen every 6 hours. This will keep the fevers down a little bit better in children and make them feel just a little bit better. Cool baths are fine. Cool washcloths, that kind of thing, stripping them down a little bit. When you have a fever, you feel cold, so those are a little bit more uncomfortable for children versus the actual medications for fevers. So if your child has a fever, you want to talk to your doctor. If the child is under 2 months, immediately in the setting of a fever, they should be seen. If they're over 2 months, typically we say a fever greater than 103, you may want to call your physician, or 3 days of fevers.